Okay, we are live now. We can start.
Uh, Good evening and warm welcome to all. I, Namrata Padli, shall be the host for today's evening. So, here I am again with another webinar session on community health with Enajori. So, before moving on, I would first like to brief you all about Enajori. So, Enajori, as the name suggests, it literally means the bond of love. Milindatta is the founder of Enajori, and it is his love for his native land that brought him back from USA to Assam to start this non-profitable organization which engages and promotes various initiatives such as striving for social change, loving leadership qualities, and building entrepreneurship capabilities among the people living in northeastern India. So, for a few months, we have been working with several speakers from different regions. We have talked to them and we have also discussed various topics which are very relevant in today's generation. So, moving forward, coming to today's discussion, today's topic of discussion is tackling the alarming increase in oral cancer incidences in the northeastern region. So moving forward, today we have our guest. His name is Dr. Aklanta Kumar Gogoi. He is a maxillofacial oncosurgeon from Shivsagar, Assam. He did his MDS in oral and maxillofacial surgery and fellowship under FHNO Mumbai. He is a consultant at Apeksha, Swastha, and Brahmaputra hospitals in Dibrugarh. His aim is to provide information on oral cancer treatments and related maxillofacial and dental treatments. So now, welcome, sir. Now I would like you to take over the screen. Please, sir.
Yeah, thank you. Thank you. Thank you, Namrata, for inviting me. First of all, good evening and namaskar. My name is Dr. Aklanta Kumar Gogoi, and as been informed, I'm a consultant maxillofacial oncosurgeon. I'm currently practicing in Dibrugarh. So, first of all, I'd like to thank Enajori for arranging such a wonderful event, such an interactive session where we can exchange our ideas, we can have a face-to-face communication regarding the very much relevant topic of the day, that is oral cancer, which has increased significantly in the northeastern region. So without further ado, I'd like to start with the session. So when we say the word cancer itself strikes fear, a sense of apprehension in the mind and soul of an individual. And I think it is correctly said so because not only it affects the individual, it takes financial and mental toll on the patient as well as his family. Now, unfortunately, our Northeast is one of the leading regions in this severe debilitating disease. Now, why is this happening? How it can be tackled? What can we do about it? This is the question of the hour. As a practicing doctor, I have been very unfortunate to see so many cases of oral cancer throughout the day. And actually, because of the lack of awareness, we see that most of this disease, by the time they reach us, we get them in a very advanced stage. So what can we do about it? So before we delve into further details, I'd like to stress upon what is oral cancer basically. So as we all know, cancer is basically the uncontrolled growth of our body cells. And oral cancer is just one subcategory of a broader term known as head and neck cancer. So basically, head and neck cancer comprises of the cancer disease that occurs in our nasal region, in our mouth, and in our throat region. And in our Northeast India, oral cancer has taken a lead significantly. The incidence of head and neck cancers, as per the latest survey, has increased more than 50%. in Northeast. And unfortunately, 90% of the burden is oral squamous cell carcinoma. Now, when I use the term squamous cell carcinoma, it is the most common type of mouth cancer that we encounter in our day-to-day lives, in our practice. Apart from that, there are other types known as basal cell carcinoma, verrucous carcinoma, malignant melanoma, and amyloblastoma. But the common most that we face is oral squamous cell carcinoma. And this has been recorded as one of the top 5 causes of death worldwide. In a 2015 study, a certain study was conducted by a reputed journal where it showed that oral cancer tops among all the other cancers in the Indian male population. And it is the third highest recorded cancer in the females. Now, when we see the clinical picture of this disease, there are certain general terms, then we can, I need to familiarize you with. So this disease we basically find in the 5th, 6th, and 7th decade of life. But the post 50s of a person's life, this disease is usually detected. But a recent 2021 study, which was conducted by one of the leading cancer institute of our region, Dr. B. Bora Cancer Institute. They conducted a study in 2021, and it is very sad to, the outcome is very sad. We came to know through this study that 56 patients have been diagnosed in the year 2021 itself who are aged between 25 and 40 years, which is very alarming. And the recent trend all over the country has showed an increasing trend in this age group of 25 to 40 years, where this oral cancer has been diagnosed. And this is really, really alarming for all of us. And it really makes the question of the hour that why it is happening so much. Now, when we come to our oral cavity or our mouth, there are certain areas, there are 7 subsites, as we say in our language, which are more vulnerable to develop cancer. So this is the first and foremost area is the buccal mucosa. Buccal mucosa is something known as the inner lining of the cheek. Then comes your tongue. Then the third molar region near the teeth region, the upper and the lower gums, the palate, and the floor of the mouth. So the floor of the mouth is basically the area that is present in between your tongue and the lower gums. Now, as per the National Cancer Registry, as pertaining to the topic of today's session, in the Northeast, the highest incidence of oral cancer has been recorded in the in the East Khasi Hills of Meghalaya, followed by the Kamrup district of Assam. And out of this, the 25% of the population that has been affected are males and 8% are females. Now, if we see the etiology of this disease, we are all aware of it. We all know about it, that the main culprit in causing mouth cancer is unlimited and high consumption of tobacco and alcohol. Now, if we see our northeastern region, I may not be aware of the other states, but in our Assam, the use of betel nut or tamul pan, as we say, it holds a very sacred place. It has a very sacred place in all the family traditions or whatever traditions we have. So the first thing, it's no more a taboo or social stigma to consume betel nut and pan. And once people start consuming betel nut and all, they start taking all this slake lime, tobacco, which all the more increases the harmful effects of these products. Now, I'm not against any cultural traditions or anything, but the use of such products has actually, if use of such products are inculcated at a very young age, it leads to other deleterious habits like gutka chewing, smoking, and alcohol consumption in a later stage of life. Now, I'd like to, before we go into other details, I'd like to put a few facts or statistics. Now, in 2010, there was a study that was being conducted by the Global Adult Tobacco Survey, known as the GATT survey, which showed that 60% of these tobacco users go for smokeless tobacco. Smokeless tobacco basically contains all this chewable tobacco, gutka, and all those pan masalas. And out of 275 million tobacco users, 164 are smokeless tobacco users. 164 million people are using smokeless tobacco, means gutka chewers. 69 million people are smokers, and 42 million are both are using both smoke and smokeless tobacco. Now, I'd like to focus in today's session mainly on the habit of gutka chewing, because I think everybody will agree with me when I say that this habit has created a nuisance. It has really created a nuisance because even in civil areas, even public areas, we see people loitering, people spoiling the premises by spitting here and there. Moreover, the most alarming thing that we have come to notice is that even school-going children, college-going students have developed this habit. So basically, gutka is what? We know it is a commercially prepared, it's a commercially prepared, sun-dried, roasted, all, spice. Basically, it's used, taken as a mouth freshener. Another question is why the gutka consumption has increased. As I said, certain habits that have been developed during childhood and has been normalized in our society, they lead and they evolve into more deleterious habits of this, like this gutka chewing. First of all, it is easily affordable. A gutka packet is easily affordable. It's nicely sealed, and young students, young boys can easily carry it around in their pockets. And it doesn't cost much. So within the budget of the pocket money, they are able to afford it. And there is a myth among these users where they say that chewing tobacco or chewing gutka is less harmful than smoking a cigarette, which is absolutely wrong. Now, as we have seen in our recent television ads, and there have been so many controversies regarding when we saw prominent Indian actors promoting these brands. There has been an aggressive marketing strategy that has been employed by these gutka brands, and hence our younger population is getting attracted to its use. They come in conveniently sealed packets, and they come at an affordable cost, which makes their life more easier procuring all these items. Also, even though the government has enforced strict rules all around the country, but yet we still see all this strategically placed small pan bhandars or pan stalls, whatever you say, they are present near the school premises. If they say it should not be present within 500 meters, maybe you will be lucky enough to see some random pan stall within the 50-meter of the school premises. So this is actually very alarming and very, very thought-provoking for us. And because of its easy availability and the sweet taste, people consider the instant stimulus that is provided by chewable tobacco something they can relate to as a stress buster, which is absolutely wrong. So because of the lack of social stigma, because of this aggressive marketing strategy by the gutka companies, and because of the easy availability of these items, and because of the most importantly, the psychoactive effects of nicotine, the younger generation is getting attracted, and more people are consuming gutka. Now, if we break down the components of gutka, then we all know they consist of areca nut, they consist of slake lime, they consist of your something known as cat chew, which contains tannic acid and quercetin. So studies have shown that one single packet of gutka contains more than 4,200 chemical compounds, and most of them, 90% of these components, are carcinogenic. So what is the mechanism? We have to understand what is the mechanism through which this gutka habit can lead to mouth cancer. So first of all, the use of slake lime in these gutka packets, they cause micro abrasions in our cheek lining. They erode our cheek lining. They cause constant irritation to our mucosa. So the inner lining of the cheek is something known as mucosa, oral mucosa. So our body has the tendency to regenerate and repair after any damage. So once the gutka user takes a packet, he destroys his inner lining of the cheek, the body repairs. But this on and off process, sometimes the rate of consumption surpasses the rate of regeneration. So this leads to, we can say, some deficient mucosa taking place in place of the healthy mucosa. And this, in the long run, over a long run with a heavy consumption, it can cause some genetic aberrations, which can lead to such diseases. Now, certain warning symptoms and signs are always present, are given by our body when such an event occurs. So the first and foremost thing is a non-healing ulcer that you might find in your mouth for more than 2 weeks. And interestingly, these ulcers are non-painful. They do not cause any kind of pain to the patient. They do not cause any trouble to the patient. Patient can easily eat and they can carry on with their normal life. And hence they continue with their habits. It's only at the later stages when the disease has progressed to an advanced stage that they decide, once it is troubling me, I'm going to visit a doctor. So the first and foremost thing, if you are a gutka user, if you are a person who has any kind of habits, make sure you go for a routine screening for in a dental setup or to a general physician. An ulcer which has been there, it is not healing for more than 2 weeks, it is non-painful, and with, of course, the size has been increasing gradually. If such an ulcer comes into your notice, then kindly take immediate action for its treatment. Apart from that, if you find there will be people who will be complaining about difficulty in swallowing, or they might complain of a foreign sensation of a lump in their throat. So this is one of the warning symptoms where in the base of the tongue, where in the root of the tongue, a suspicious disease can occur. In such a scenario, a patient will have complaint of foreign sensation or lump in the throat. Apart from that, there are certain pre-malignant conditions or lesions, and in these days we term it as oral pre-malignant lesions, something known as OPML, which I'd like to bring forward into this discussion because these are the most commonly encountered lesions that I have faced in my day-to-day practice. So there are certain pre-malignant lesions, or you can say certain warning symptoms that are provided by our body. If you're aware of it, it will help us to easily refrain from continuing the habit of gutka chewing. So one of this is something known as leukoplakia. So what is leukoplakia? Basically, leukoplakia is a whitish patch that is present in the lining of your mouth. It can be present on your tongue. It can be present on your cheeks. It can be present on your, we can say on your palate. And it doesn't easily scrubs off. If you try to rub it off, it won't come off. So it is, if such a lesion persists for more than say 10 to 15 days, then we can be certain that it can be pointing towards a pre-malignant lesion, something known as leukoplakia. Another term we use is erythroplakia, where there's a reddish kind of patch. And this is very, very dangerous, and it has the highest rate of conversion into a malignancy. So before I delve into further details, there's a particular difference between pre-malignant and malignant lesions. So pre-malignant lesions basically are not basically cancers, but they are the potential area of changes where a cancerous ulcer can develop. So I talked about leukoplakia, we talked about erythroplakia, and one of the most common issues that I have found in the gutka chewing people is something known as oral submucous fibrosis. So these are the patients where you will come across, they will usually come with a complaint of a burning sensation in their mouth. They won't be able to consume any kind of food. While eating, they will complain a lot of burning sensation. They will be having difficulty in opening their mouth. If a normal person is able to open their mouth by 5 centimeters, maybe their mouth opening will go down to 2 centimeters. Or in unfortunate cases, they are not able to open their mouth even for 1 centimeter. And if we see inside their mouth, we see the complete texture of the cheek lining changes. If our normal cheek lining is reddish or pinkish in color, it changes to yellowish or whitish. And this is something very dangerous, the oral submucous fibrosis, because it is a progressive condition. So why is this happening? So imagine the work of a painter. Before painting a wall, a painter whitewashes the wall, then uses primer. Now, if you throw some dust on this wall, the dust particles easily sticks to this wet surface. So basically, the gutka quid that we say, the quid of the gutka, basically it acts as a primer and it wets the entire area of the mouth. Since it is a liquid, it has the potential to go into those coffin corners of the mouth. Coffin corners, matlab, the areas where, usually it is not non-accessible to a toothbrush. These are the coffin corners of our mouth. But being a liquid, they sip into these coffin corners, and in a long term, they can cause certain changes in these areas which may not be visible if you look yourself in your mirror or if you have a routine examination of yourself. So such a condition, if it is progressive, it has the potential to start from your mouth and it can go to your entire food tract. And once it involves the mouth or the food tract, the entire flexibility or the resiliency of the mucosa is compromised. And such a person suffers from dramatic weight loss. They will have difficulty in swallowing and eating, and most of all, they will be highly malnutrition. Now, we have to keep in mind that our mouth is the first orifice that is exposed to the external environment. Day and day basis, we eat so many things. And our mouth is exposed to so many environmental pollutants. And out of this, almost 90% of these environmental pollutants are basically, you can say, carcinogens. There are so many adulterants in the food that we eat today. This adds to the increasing and alarming incidence of oral cancer in our region. Although there have been other recorded instances where we see that even a person who has not consumed tobacco or smoked a single cigarette in their life, they develop oral cancer. Now, why is this? Now, studies are still going on this topic, and it's still a topic under research. But what we have as evidence, as a medical evidence in our hand, it's mainly because of certain virus known as human papilloma virus or Epstein-Barr virus. And unfortunately, the female population has been, as we have seen, the female population are more susceptible to it, especially the tongue areas. There have been cases which I have seen in my career where a lady came to me and she's told that I haven't taken a single bit of pan, tamul, or I haven't had alcohol ever in my life. Why did I get this? So these are the gray areas where we need to go for further research. As we all know, oncology is a huge field, is a broad field, and still research is undergoing. Apart from that, I'd like to, for the general awareness, there are certain factors that I'd like to stress upon. We all know tobacco, alcohol, whatever it is, they are the main culprits behind oral cancers. Apart from this, if you are having any kind of chronic mechanical irritation in your mouth, especially from your dentition, from your teeth, if you have any sharp edges of your teeth that is constantly causing trauma, or it's constantly causing ulcer, some kind of ulceration in your tongue or on your cheeks, then kindly get it treated at the earliest. Because in the long run, chronic mechanical irritation causes the same mechanism of regeneration and repair, which is caused by tobacco, as I explained earlier. Apart from that, there are so many adulterants in the food, and this is unfortunately something that we all have to live with. Apart from that, there are also certain immunosuppressed patients who are susceptible to this oral cancers. Certain dietary factors also we have to take into account, where the lack of consumption of green leafy vegetables, consumption of too much of red meat can cause such conditions. Basically, the nutritional status is compromised. Now, coming to the question, if we want to tackle, what can we do to tackle these conditions? So, oral squamous, sorry. So, oral squamous cell carcinoma, the first and foremost thing is, I'd like to say the age-old proverb, prevention is better than cure. If you are having any habit, if you are having any kind of habits like tobacco consumption, alcohol consumption, I'd recommend to go cold turkey. The first and foremost thing is to go cold turkey. Cold turkey means you have to completely stop, complete cessation of the habit. And if you're a smoker, if you're a gutka chewer, reduce the number of packets that you're consuming day by day. It's always better if you stop it in one day, but I know it's not possible. So you can taper the amount of gutka that you are chewing every day. Apart from this, I would recommend a daily exercise. If you're having a routine of daily exercise of minimum 30 minutes of cardio workout is really helpful, because it helps in relieving the body of its toxins and makes your cardiopulmonary system more active. The more the blood circulation is to these sites, the more the amount of support our cells are getting to fight disease. And if we talk about dietary supplements, then so many research are going on into new products. There is a certain known as chemo prevention. We all know about chemotherapy, but there is a certain concept that is coming into account these days, something known as chemo prevention. So there have been certain antioxidants, certain ingredients in our naturally available food resources, which are under research and which are showing extraordinary results in tackling or preventing oral cancer. So one of the common things that I recommend to my patients who have been diagnosed with a pre-malignant condition is curcumin, basically. So what is curcumin? Curcumin is basically a component which is available in curcumin longa, that is turmeric, haldi. So nowadays, so many multinational companies, all the pharmaceutical companies are investing a huge amount of money into this business, where they are extracting this curcumin from the naturally available turmerics that are available, especially in northeastern region. We northeastern states are quite rich in food resources. And out of this, haldi is a common thing which is commonly found in all the households of Assam or all the other northeastern states. So this curcumin has research shows that there is a huge potential of anti-aging, anti-inflammatory, and it has a anti-oncogenic properties. It helps in the prevention of cancer, not only for oral cavity, even it helps in tackling cancer in other sites like breast cancer, lung cancer, the liver cancer, and pancreatic cancer. So it has shown huge promise in the treatment of these diseases. So if you have potential, or if you have the access to consume this haldi, you can take a little bit of haldi, mix it with some lukewarm water, and have it in the morning on an empty stomach. You can have it, or you can mix it with milk and also have it. So I personally would recommend all my patients, and as well as all my participants here, that there's no harm, no side effects in here. Research has proven that this is a very safe thing to consume, and you can continue as long as you want. Now, coming to antioxidants. Now, there is a huge controversial area when it comes to antioxidants, because there are certain myths that are prevailing to the consumption of antioxidants. So in general, I would say in moderation, you can take some amount of antioxidants. You can have 3 cups of green tea That's all right. But nowadays, what if you see the online marketing portals? They are marketing so many things. They're using the fear as a marketing tool, and they're selling so many things, citing as lung detoxers, something, that products that they claim fights cancer. So out of this, there are certain products which have been scientifically proven to be really efficient against against the development of oral cancers. One of them is astaxanthin. Though astaxanthin is found naturally from non-vegetarian sources, especially from seafood and shrimps or algae. And there is another known as beta carotene. Now, beta carotene, we have to be very careful with the consumption of beta carotene. So where do we get beta carotene? Beta carotene basically is available in yellow and orange pigmented fruits. You can get it in capsicum, the yellow capsicums. You can get it in oranges. You can get it in carrots and pumpkins, as well as pears, strawberries. But the catch in beta carotene is that it is scientifically proven that if you are an active smoker, if you're an active smoker, please refrain from using beta carotene as a supplement, because beta carotene has been found scientifically to enhance the proliferation of lung cancer. So this is something that I want to bring forward in this session. Apart from that, there are components like lycopene. Lycopene is available commercially as a supplement. You can take it as a vitamin source, like we take a normal multivitamin syrup. It is available in a syrup form, and not for a long run, over 10 to 15 days. I'd recommend people to take it because it has really proven efficient in fighting against the development of oral cancer. And if we talk about naturally occurring sources of lycopene, we find it in tomato, eggplants, and papaya, grapefruit, watermelon, and so on. Now, the question of the hour is, in spite of all these precautions, in spite of all this knowledge, people yet they go for consumption of tobacco. They go for smoking. So it's a question of willpower, it's the question of self-control. Always remember, when you are healthy, when we are healthy, when health is with us, we don't have to worry about the second or any other thing. But once this disease catch hold of you, please keep it in mind. It is very, very difficult to get rid of head and neck cancers, especially oral cancers. When we treat a patient, we generally see the survival rate in terms of 5 years. If a patient has been diagnosed today with oral cancer and we operate him, and the first 1 year after his operation is very crucial to us, because we have seen cases which come back. The recurrence of cancer is there within 4 to 5 months. And this, again, I will stress upon, is because of something known as field cancerization. Field cancerization matlab is the same thing where the gutka fluid, the gutka quid, it goes into all the coffin corners of your mouth and it causes genetic aberrations. It has the potential to cause genetic aberrations in any part of your mouth. So, first of all, self-discipline and self-control is the first and foremost prevention, I would say, against this dreaded disease. Apart from that, if you have the habit of getting 30 minutes to 1 hour of exercise, that's a very healthy habit to inculcate. And it basically helps in fighting against the free radicals that you have in your body, does the same work as antioxidants, expels the body of toxins, and also improves your cardiopulmonary system. Apart from that, please refrain from having too much of, since we are from Northeast, and we have the habit of having, many of the people have the habit of having meat. Meat means chicken, or broiler chicken, local chicken, whatever it is, or pork or mutton. Please refrain from having too much of mutton. or sorry, red meat, I would say. I won't generalize, I won't pinpoint, but I will just say, please refrain from having too much of red meat. It is one of the leading cause of causing oral cancers as well as colon cancers. Another trend we have here is the habit of consuming smoked food. The smoked food items are a delicacy in almost everybody's cuisine these days. But smoked pork has been directly related to the increased incidence of throat cancer as well as colon cancer. And when I was working in Mumbai, most of the northeastern population that we had, most of the northeastern patients that visited us for treatment were suffering from colon cancer as well as throat cancer. So there are studies, you can even Google it, where it is scientifically proven that consumption of too much of smoked food has the potential to cause colon cancers as well as throat cancers. Now, coming to the treatment aspect, if any one of your relatives or any one of your known close or loved ones have been diagnosed with this, unfortunately has been diagnosed with this debilitating condition, the first and the foremost thing I would suggest is kindly suggest them to go to the doctor at the earliest. There is a misconception among people where people go for the indigenous method of treatments, and by the time they reach an actual oncology institute, they are already in the fourth stage. So this is a genuine suggestion that I would advise as a doctor to all of you. And the first line of treatment, if it is treatable, the first line of treatment in mouth cancers is surgery. Yeah, I do agree it is a disfiguring condition where we have to, if depending on the severity of the disease, we have to remove part of the face or part of the mouth, but we have to reconstruct it. The first and foremost line of treatment in mouth cancers is surgery, followed by radiotherapy and chemotherapy. There are certain research going on regarding targeted therapy, something known as immunotherapy is also going on. But as far as head and neck cancer is concerned, the research is still yet to prove some kind of evidence proving its efficacy. So these are the certain information that I wanted to provide to all of you regarding this topic of oral mouth cancer. If any one of you have any kind of queries or questions, I'll be most happy to take questions.
Thank you, sir. All these were really very informative for us today in this discussion. So, sir, I would like to ask you a few questions from this discussion today. So, when you say that there is a lack of social stigma in Assam, so, the main problem is that we ourselves consider chewing tobacco is a tradition.
Yes,
it's a tradition in Assam.
Indeed,
So, sir, what are the other stigmas and myths that you have come across throughout your?
Yeah, it's a very good question. The other stigmas that, see, basically what you said, the consumption of tobacco has been, the offering of pan tamul, as I said, the offering of pan tamul has been very traditional in our culture. And the other stigmas that we saw is the, in my practice that I have seen is like indifference. The indifference of people towards a certain disease, because most of the people, they think these ulcers are because, when they consume tobacco, they have all these ulcers in their mouth. They keep on healing. They think it is going to heal. So indifference is something that I have seen. And other stigmas, if you say, the people usually. People usually think that cancer treatment is very expensive, which indeed it is. But in spite of spending so much money, let's go for some indigenous treatment. This is one that I have faced, where people go for indigenous treatment, and once the disease is there, no amount of indigenous treatment is going to help. And by the time they land at the hospital, unfortunately, they're at a stage where we can't save them and they have to go for supportive therapy only. Yeah.
Thank you, sir. And again, when you talked about adulteration of food, so what exactly you meant by that? Like, what are the things that come under
See,
this?
this things, see, all this the use of pesticides and insecticides, basically. And if you take an apple from a market, you will see all these wax layers on the apple. If you take suppose sometimes we get coriander or dhania, if you wash them in water, you will find the green color coming out. Artificial colors substitutes. You'll find artificial color substitutes. You'll find wax on these apples. And if some people, they go to gym and they consume bananas. Even be careful while taking bananas, because you will see they are artificially ripened using borax powder. So these are even the masoor dal that you have, if you wash them, you will find this foam coming out of this masoor dals. Some foam kind of thing, which are basically colors as well as your insecticides, pesticides, whatever you say. So these are the adulterants and that usually are found in our food. And this is one of the reasons why people are resorting to organic farming these days, why organic farming has become so important to people.
So then, can you describe any complex or challenging cases you have encountered in your practice, and like how you have managed them?
Any complex cases you mean to say? Yeah. So the most challenging case that I have come across was basically a lady. She was a 70 years old lady, and she had the habit of chewing pan tamil. She didn't have any habit of tobacco consumption. She didn't have any drinking habit, nothing. But as I said before, these ulcers are basically painless, and she didn't see this. She just thought it might be a normal, it might be a normal trauma from her teeth, where she might have bit on her cheek. She thought like that, and she kept it like that. And this disease, though it started as a stage 1 disease, by the time she came to us, it was stage 4, where the ulcer became so big, it became so proliferative that it involved the external skin of her cheek. And it was there are certain pathways for the spread of a cancer, if I might say, especially in this buccal mucosa. If it happens in the inner lining of your cheek, it has the potential of spreading very fast. And if it is near your bone, then it becomes all the more challenging. So this lady, unfortunately, suffered from such a condition where it started on her cheek, then it spread to her external skin. It involved her upper and lower jaw. So this lady, considering her age, we faced a formidable challenge, because we could not subject her to chemotherapy, as chemotherapy, itself makes the person very weak. And a 70-year-old lady cannot be subjected to chemotherapy because of the side effects of it. So we used a regimen, something known as NSAT, neoadjuvant chemotherapy, where there is a shrinkage of the tumor, some amount of shrinkage of the tumor. We expect around 5 to 10% shrinkage of the tumor. And once some medical fitness was certified, we had to operate on her. It took 8 to 10 hours. It took 8 to 10 hours to operate on her, and finally had to reconstruct everything. But unfortunately, I would like to stress upon the fact that that if a person is diagnosed with oral cancer and the disease is already metastasized to the neck region, then the prognosis comes down by 50%. This is a written fact in medical literature. The prognosis comes down by 40 to 50%. This lady, we operated on her. She underwent radiotherapy. She was okay. She lived for 2 to 3 years. But unfortunately, the disease came back again. And this time, we had to put her on supportive therapy, because the patient didn't want herself to be subjected to again a surgery like this. And it's like basically she gave into her fate. And unfortunately, God rest her soul, we lost the patient. But yeah, we were able to give 2 to 3 years to her in her life. Yeah, this was the most challenging yet emotionally challenging case for me so far.
So, sir, in that case, how do you communicate with patients and their families throughout the treatment process? Like, particularly when delivering the difficult news or discussing treatment options?
Yes, yes. So when we deal with such a patient, basically oncology doesn't only comprise of oncologic care. The oncology care doesn't only comprise of your, just the doctors. We need help from other sectors also. So when a patient comes to us, we do a biopsy, and unfortunately, if the disease comes, first of all, we make it a point that we explain it to the family members first. Make it a point we explain to the family members first, and if it is available at our disposal, we take help of the clinical psychologist. We take help of the dietitians to prepare a proper dietitian chart for the patient. If the patient we see, because most of these patients, by the time they come to you, they'll be malnutrition. And even for the surgical fitness of the patient, we need to improve on their diet. So it's a multimodality approach that we do in such a patient. And of course, in breaking the ice with the patient is the most challenging part, of course. And once the biopsy, we always do this once we have the biopsy report in hand and we have the scans in our hand. We explain to the patient that this is the condition that you are having. And yeah, some patients do tend to have a very negative approach. They say that, yeah, this, you might be wrong. Yeah, we have been questioned on our diagnosis too. I won't deny it. We have been questioned on diagnosis too, but yeah, the truth is truth, because such diseases do not hide. One day or the other, they are going to come out, and the patient realizes themselves. And most of these patients, basically, when they come to you, they already know that something is wrong. So 50%, you can say, they're mentally prepared for a bad news. And the rest 50%, unfortunately, we have to break the news to them.
So, sir, then you again talked about some existing policies or regulations related to tobacco and alcohol consumption earlier in this discussion.
Statistics, yeah.
So, should these regulations be strengthened or revised to address the current situation? Because many of the policies are not like, yes, sir.
Of course. There are so many laws already that have been passed. Earlier, you used to see a small picture. If you have seen all the cigarette packets in the shops and all, earlier they used to just give a statutory warning. Then another law was passed where they made inclusion of a picture. Then the picture size got increased. Though all the regulations have been going on, and people, they're trying to incite some, there is even a tobacco cessation helpline provided by the Indian government, where people can call up and take psychological support and from a counselor to quit the habit. But yet the incidence is increasing day by day. Yeah, I definitely feel there is a need to tighten or make these laws very stringent. Unfortunately, due to certain economical and certain revenue generation issues, I think the government has still yet to take a firm ground on this. Even there are laws where where they have mentioned that no pan stalls or no tobacco products should be sold within 500 meters of a school or college. But I think you yourself might have been a witness to this, where we see this is not being implemented, so which is very sad. And this has actually contributed. This has actually contributed to this alarming increase in the oral cancer in our region. Definitely, yeah, I agree. There is a very strict requirement to implement these laws.
So, sir, what do you think? Like, how far technology has advanced in order to address these issues? regarding oral cancer and all?
Yeah, there are certain. If you say technology, it's a very broad term. So yeah, there have been scans like PET-CT scans and all, where we detect the earlier we used to have to give an endoscopy. We have to go for ultrasonography of the abdomen. We have to advise a CT scan of the mouth as well as the lungs to see if the disease is there in the mouth or if there's metastasis to other place. Now we can bypass all this and we can go for a PET-CT scan. Apart from that, yeah, there is a recent technology which is something known as Valscope. And though it has come to India, it is yet to be implemented and fully enforced in all the oncologic institutes because of certain price, because it's a very costly equipment. It's a very costly equipment, and Veloscope basically helps in detection. It's where they when they give a light, they shed a light on the lining of the mucosa, and they basically detect any kind of precancerous changes that is going on with the mucosa lining. Technology is there, definitely, but yeah, the cost-effective ratio is still something under question.
So then again, while consulting with your patients, so how do you manage the emotional challenges associated with treating patients with maxillofacial tumors?
Hmm. Sorry, I got cut off. Can you repeat the question, please?
Sir, I asked that when you consult with your patients, so how do you manage the emotional challenges associated with the treatment of these patients with maxillofacial tumors?
Yeah. So, of course, it's a very devastating news when you crack the news to the patient, and we try to give as much as emotional support as possible, be it counseling if it is required. Then we do a counseling of the patient. Sometimes we hold a rehabilitation or support group. There are certain oncologic support group where people afflicted with cancers come together and they talk about their ordeals. So it's a kind of human psychology. When they see another person fighting this disease, they get the motivation and inspiration to fight back with the same zeal and enthusiasm that the other person is doing. So I generally tend to intercommunicate between the patients, of course with the permission. If there is if the confidentiality of the patient is taken into account, definitely. But if they're open to it, I try to hold an onco support group. I try to bring these patients together and have an interactive session between themselves, because the person who is suffering themselves can be, they are better at understanding the problems of the other person. And of course, as I said before, oncology treatment doesn't only mean consists of doctors. It comprises of psychologists. It comprises of dietitians. It comprises of even swallowing therapists, where once a patient loses part of the tongue, if a patient loses part of their tongue, then they have to adapt to the new musculature that we provide them. So it's a multimodality approach and support, definitely.
So, sir, have you made any research or academic contributions in the field of maxillofacial and oncology?
Yes, I have. I have done certain studies in the field of biopsy, where we did a comparative study between taking a biopsy, performing a biopsy with a blade or a laser with a better result, which we did a comparative study between basically a laser biopsy and a scalpel biopsy. And apart from that, we did a research on, it's basically a surgical research item that we did, where we uh, did a research on the approach, how to approach the skull. If a disease is approaching the skull base, how do we approach it? Should we approach by, through the corner of the mouth or through the middle of the mouth? There are certain technical terms to it. And apart from that, there have been a research based on radiotherapy too, where we see how to tackle the, the side effects, the toxic effects of radiotherapy and chemotherapy combined.
So this shall be the last question from my side. Sir, what do you find most rewarding about working as a maxillofacial oncosurgeon?
Yeah, so see, if I may correct the question, the greatest reward for any doctor, regardless of their discipline, be it a surgeon, be it the medicine, is to see their patient go back smiling, is to see their patient happy and healthy. The most rewarding aspect of me being a maxillofacial oncosurgeon, if I am to answer your question, is if I feel most happy when I'm able to diagnose a disease at an earlier stage. Because most of these patients, sometimes they come with a dental issue. They will come, I have a toothache. And incidentally, I have found patients with, having some kind of suspicious lesion adjacent to their teeth. And it is really, really rewarding for me when a patient thanks you, really expresses their gratitude for treating them. And especially I focus on the early detection of disease, or if a patient is suffering from pre-malignant lesions. So I found it very rewarding when a patient comes and thanks me, and it indeed feels very good when some people thank you for diagnosing them at an early stage. And of course, seeing your patient live and carry on with their life is the greatest reward that I can have as a doctor.
Okay, sir. Thank you so much. It was really very informative while talking with you today. So, sir, it's also our honor to have you today as our guest. Thank you, sir. We also hope for further such interactions in the future as well with you.
Yeah.
So, thank you, sir, for being a part of today's session.
Thank you, Namrata. Thank you. Okay. Thank you for inviting me. Thank you.